Good afternoon, Tewksbury. It is Tuesday, April 7th, 2020. It is 1:02 p.m. and I'd like to start this virtual special meeting of the Tewksbury Board of Health to order. Since this is a virtual meeting, I would just like to have a roll call of those people that are present on the call today. So we'll start with board members first. Maria?
Robert Scarano, Vice Chairman.
Thank you, Bob.
Charlie Rue, I'm here.
Dr. Anthony
Thank you, John.
Bichetti, I'm here.
Thank you, Tony.
Is Susan
And Maria,
on
you're
board?
muted. Maria, you're present?
Here she is.
Maria is present.
Perfect. Okay. And then from Town Hall, or the town employees?
Susan, I'm mute. Susan Sawyer here.
Shannon Sullivan here.
Okay. I think we'll begin. So we have just two items on the agenda for today. First is the, thank you, my feedback. Okay. First on the agenda today is public health emergency operations for COVID-19 pandemic. It's a document that Director Sawyer has been putting together, and I've been looking at in terms of what's the plan for how the town is handling this COVID-19 pandemic. So, Susan, I'll turn it over to you.
Good afternoon, everybody. Thank you for coming to this first, well, maybe second, but WebEx meeting with the Health Department and Board of Health. And Richard, thanks for joining us. As you know, Richard is Montori is our emergency management director. Since this started out in February, back with the Italian students, it's been quite the journey into the emergency management world, which we haven't had, luckily, too many in my 27 years. It's been a learning one as we've gone through. We really were thrown in early with our Italian students, and we made that through with some bumps and grinds, but no positives and no illness from that, which is fantastic. And then, of course, we got into the bigger and better part of this. It's not better, but bigger part of our emergency preparedness that we've been working on all these years, which is responding to very serious public health emergency that is not just local, but it's state and international, as we know. When it comes to emergency management, like I've mentioned, Richard is our EMD. He's responsible for major operations, and in a public health emergency, he's also our public information officer as well. So you hold a lot of hats, Richard. It's been really good working together. Immediately, we got together as a team with all the pertinent department heads, basically set up basic, ideas of what we're each going to be doing, and then getting together at certain periods as it all unfolded. Then I remember you guys came up with the ideas that we needed to do this emergency, town emergency with the selectmen, and that came off quickly and with a lot of speed within like one morning, and had it in the afternoon. And came with your emergency order for shutting down of salons and other service industries. And so that was that was done, and then shortly followed by the, it wasn't done, but we started over the weekend. Everybody, Maria and Brittany and Shannon all pitched in to make the lists and phone calls and everything that it took to reach out to all the businesses. Then, then the governor did his thing. So basically, the governor went way beyond what the local board of health did, and we've been living with that since. And every week, a new directive from the governor. Every week, a new. Not even every week, probably every other day, right? So we've just been keeping up on that, trying to stay ahead of it if possible. But it's really been a lot of listening to what we need to do and then taking action. And of course, at that time also, Richard and the selectmen, and they had to make the tough decision of closing the town hall to people, sending people home, trying to figure out who can work from home, who can't work from home. So there's been a lot of logistics as well as, putting it together in a document. So now here we are lucky. We can have this wonderful WebEx meeting, and we can all talk about where we've been very quick about amount of time. So in the guidance book for the boards of health, by the Association Boards of Health, there's a document that lists all the purview during this time, emergency preparedness for public health. So we took the bullet points from that and created an emergency document, which I'm going to try and share with you all if I can. What I just learned, and there she is. Can everybody see that? I can't hear anyone, so hopefully you're all there. Should I be able to hear everyone?
We can see it.
Oh, okay. Everybody's... You don't need to unmute, Jason. Okay, so this is the basic format that, like I said, it started in bullet points, but now it's walk through the purpose and the legal authority. This is right out of the guidebook. This is going to be created, formed into a document that we actually put up. So I'm just kind of scanning through it quickly. Different topics like the Emergency Operations Center, which at this point we're just working out of the town manager's office. We don't have a physical spot. Other things that the health department does is health surveillance. That would be headed by Irvi. You can ask her some questions about that in a minute. And that's based on all communicable diseases all the time, not just today. Isolation and quarantine is shared between many parties if it were to come to actually doing more than just asking people to self-quarantine. If we ever had a person say who chose not to, there are, in causing a public health issue, we have ways to deal with them. Logistics, bringing volunteers on board, working with the most local medical reserve corps. Support for emergency shelter operations we don't need right now, but it's always in there. Future, you never know. Resident care. There we go, linking people, personal health services. There's lots of people involved in that. So we also have a clinician through the police department if we need some mental health care, and I've reached out to him as a clinician, and they have a team that can help us for mental health care. Communications, primarily out of town manager's office. Janine is supporting us with the website, town manager's assistant, and we all kind of submit and help with the update of all the data that goes up there. Response and coordination, town manager and myself through everyone, through the task force or the group, you call it. I haven't really had a discussion about mass fatality operations. All burial permits and things go through town clerk staff. That would be a future thing if necessary. And EDS site we don't need right now. Generally, this is what you think of with public health emergency preparedness plans, but we don't have a vaccine. So at this point, we're not disseminating to the entire town any type of thing. And there again, there's the reference. This document will be available after we have this meeting, or after we make some changes, after we have the meeting and discussions about anything else we might see. But it's working. It's a working document. Can anytime. Whoops. Did I get rid of it? Okay. You can change that anytime. So anyone, any thoughts or ideas, let me know. You might have. That's it for me right now, unless you have questions.
So Susan, sorry, I'll just chime in. One of the reasons we have this document is that while the town has a emergency management plan, that's more for natural disasters and how the public service agencies deal with life safety issues. That was not to encompass a public health emergency such as we are in now. So that's why it was important that we have our own separate document. And whereas Susan originally grabbed these bullet points to come up with a overall template, we then tried to make this be a emergency specific document that can then be sort of the understanding of so what roles and responsibilities and who has what tasks and where's responsibilities for what. So thank you for putting that together, Susan.
Who was involved in the production of that emergency plan? All the emergency department leaders? It was based on the state plan and the Board of Health and the general plans, but for our community, when it was made specific, who was involved in putting that all together, just so that we have clarity?
Mr. Chairman, if I can just jump in.
Go ahead. Rick.
Susan used the template that was provided to her. I reviewed it, and it was straightforward. It was consistent with what we use in other plans. So,
okay, that's fine. I just wanted to. That's why I thought it was. I just wanted to get clarification on that. So, because I reviewed the template there. Okay, so it was just a standardized template that was involved there. So, thank you, Richard. I appreciate that.
Richard, feel free to make some changes if you see some things you want to add.
yeah, no, thank you. And again, Mr. Chairman, it's a document that will evolve and change, and anybody that has comments will review them, and what makes sense will add or detract. So that's just how these plans and these events unfold. It's
helpful to look and see what's missing too. It's not only what to do, but sometimes you honestly forget, because you get, like I said, we were really immediately right into emergency response to a situation that was thrown at us. So then to step back and have to kind of organize after that initial issues with the school was it was good to have some framework. So I think for the future, this will be good too.
And I think the other part of this was that this is, as you're mentioning, Susan, this is not just a town-only emergency that we in the town have much more control over what's happening, but rather this is on the national level, but everything we're doing is really dictated by what the state of Massachusetts is doing. So a lot of this is outside our hands. We're more following, as you mentioned, the governor's various orders that seem to come every other day now.
Yeah, it does make it difficult, because honestly, when I'm watching the governor, it's the exact time that you're hearing exactly what I'm hearing. And it reminds me when they did the tobacco thing and then said, here, you go do it. It's like every time they come up with something, we don't have a heads up to say, no, you need to reach out to every salon, or now you need to reach out to every, large business, or, it's just coming through as he gets his advice, the governor gets his advice, then he then moves it down our way. So you never know what's coming around the corner. That's the very truth. Yeah.
I think one example of that is. Go ahead, Charlie. Tony.
I'm sorry. It does allow some latitude for our particular Board of Health's interpretation of the rules from my experience with dealing with this. And in healthcare. It does allow a little bit of latitude specific for what the unique circumstances of, in this case, individual communities are, I believe, though. So I think that's where it's very important that we look at what our community's unique circumstances are and interpret it within the guidelines and develop policies that work within the guidelines so that we're following the state guidelines, but also they allow for some latitude within the interpretation and the development of some of the guidelines that we are going to develop. That's my understanding.
Oh, yeah, exactly what you did with the going, being the forefront there with the salons and the service. That was the exact kind of thing you're talking about, Tony.
Mm-hmm. Yeah, no, that's the beauty of this, because they have, after dealing with this in different types of virus issues that have come up and emergencies that have come up over the past years that I've been involved with, I think it has to be a little bit of latitude because every community situation is different. As I said, for example, our community situation is different than, for example, a two-bedroom community like Linfield or some other community. So, and I think that's great that we're all able to work together and come up with a consensus what works best for the unique attributes of our community. So, and that's why I think they had the guidelines, because this is unprecedented. So it's a very dynamic situation that changes. So we're always going to be on our toes and making adjustments on the run, kind of like when you're playing football, doing audibles. Sometimes things change and you got to do what appears to be the best at that time. But thank you.
That's why it's good, Tony, that you were talking about us having these meetings now. And we're going to continue doing this on the same time, if that works for you, on Tuesdays. And that's separate from the regular Board of Health meeting, which is coming up next week.
Yeah, no, absolutely, absolutely. This has worked. This has worked well for all of us, and I appreciate all my colleagues and the town manager, who I know is the point person and inundated with a lot of other responsibilities, so that we can all work together and do what's best for the public health and safety and welfare of our community. And it seems like we've had some good success so far, and like everything, there's always a moving target, and we need to always strive for the best and adapt as need be. So I'm glad we were able to get these meetings scheduled. So right now it looks
Thank you, Richard.
looks like it's work well. Thank you for setting some time up, Richard, for meet with us. I'm sure you're being pulled in many directions.
So it's no problem at all. I'll meet anytime you need to, and if anybody wants to talk about anything, I'm always available.
So I don't know if you had any more questions on that particular piece, or we can just go and maybe just do some updates, or what do you think, Ray?
Yeah, I think I would still encourage the board members to look at the document, and if there are any things you can see you'd like to see maybe added, just to email those to the group,
Sure.
to the other board members, and to the director and Richard. And then again, as I was saying, this is a living document, and it has to sort of evolve as this whole COVID-19 pandemic evolves, which is why we'll keep the weekly meetings going until such time as we don't need to keep them.
Well, I think it's good we have this dialogue first, and then we can go back and review I think it's good to speak and get some input, and then go back, review the dialogue, and then we can make any necessary edits that are the consensus of the group. And so I think it's good as we dialogue right now. I always think dialogue's helpful in developing a living, breathing plan, because that's what it is dynamic. Some things have to be on the fly as things change. I don't know if anyone's heard what's going on now, but it looks like some of the data is showing that in general, there may be some flattening of the curve in some of the hot spots throughout the country. And based on information that I've heard from people that are in the healthcare research field that I'm constantly involved with, it looks like all the good stuff about social distancing has been really a good thing to do, and yet we have to also realize that the social distancing is going to be imperative for a number of a number of months, if not in perpetuity, with probably the loss of handshakes and some of the other things that we traditionally have had. But it seems like what has been done so far has given some positive results, as well as some of the medical discoveries they're working on now. So so far, so good. It appears that it could have been worse, at least the data that I'm seeing and the research people that I'm talking to that go above and beyond what's coming out of the government groups at this stage, because I'm kind of hearing from people nationally what's going on. So I'm glad we're able to do our small part in trying to contain this thing.
Thanks, Tony. Yeah, I also was on a conference call with 7 other communities earlier today, and they were talking about a spike. And one of the nurses, this time that they're saying right now, one of the nurses is saying that they're really focusing on the elder care facilities. That's what they really mean. That's what they really mean when they're saying the spike. And if any town is experiencing it, and I just want to let you know that we had the same feeling a few days ago, and Chief Hazel, along with other help from Nicole and other people in town who know all the facilities, Chief reached out to every individually, personally, to every facility to make sure we have every new, current contact, current phone numbers, and, made sure that they know that we want to be in contact with any major problems that they may be having, or concerns, or illness, so that we don't get caught off guard. We really want to be involved with them, because that's the biggest concern.
And that's wonderful that we've got a good team putting everything together, because it is important. We're in a very mobile society where people change numbers, they change addresses, they do things, and you're never going to get it 100%. But it's like I said, I'm always striving for perfection and shooting for excellence, and really, really good is not a bad thing to shoot for, because I commend everyone for doing their part on that, and I appreciate it, and I appreciate the update, Susan. Thank you.
Okay, Susan, so maybe you can give us an update from the health department where things stand right now.
Well, I guess you have to pick a topic and think about that. I know Irvy's online, since we have her, and she's so in demand right now. Our part-time nurse has been working well over 40 hours, and that's probably less than what she tells me. So Irvy, are you there if you want to say anything about how things are going today, or any updates you want to give?
Yeah, sure. So I'm sure everybody's interested.
Okay, it's you. We can't talk to you, Irvy.
Numbers are.
Yeah, it sounds very
I'm sorry.
muted and difficult. Or maybe one person can talk to Irvy and translate it to the rest of us.
Yeah, Irvy, you're slow or something. You're like on half speed. We can't hear you. It's very slow. So I won't be able to let you talk. Sorry.
Oh, really? Oh, okay.
I don't know. It's not good, but it's definitely you. So it must be something about your speed or something. It's like you're moving in slow motion. That's what it sounds like. So Shannon, are you on a voice or not?
How about this? Is this better?
Yeah, actually, all right, back to you, Irby. Go ahead. Just do your time.
Can you hear me better now?
Yes.
Oh, okay. I took my headphones off. I guess that was the problem. Sorry about that. So I'm sure everybody's interested in knowing what the numbers are. I'm sorry? I'm sorry, Tony? Can you guys hear me? Okay.
No, I could hear you a little bit better, Irvy. Thank you.
Oh, okay. Okay. So I took my headphones off. Hopefully that'll solve the problem. So I'm sure everybody's interested in knowing what the numbers are. Right now in town, we have 37 active cases. We have 11 cases that are discharged. That means they've recovered. And that brings the total to 48 cases. And, that number is growing every day still. Not as rapidly as it was maybe about a week ago, but, we are continuing to get cases regularly. I've received help from a couple of the school nurses, which has been incredible, because it's definitely not a job for one person. So I'm very appreciative to those ladies that are helping me. And does anybody have any questions about what the process is, or, you know, does anybody have any questions for me?
Just checking on the tracing project that goes with the identification of the active cases and recovered cases. Could you give me an update on that?
I'm not sure I follow what you mean. Can you repeat that? I'm sorry.
Regarding any of the tracing of the people that have proved positive, are you involved in any of the tracing?
Oh, yeah, absolutely. So what we do is we're notified by the state through the MAVEN database of who the positive cases are. You know, those are lab confirmed positive cases. And then what we do, or what I do, is I call the positive cases. I, find out what their symptoms are, when their onset of symptom was. And then we also track back to who they may have been in close contact with the guidelines are changing for this kind of constantly as we learn more about the virus. But the new guideline says that you can actually be transmitting the virus to your close contacts 48 hours prior to the symptom onset. So when we call the index case, which is the lab confirmed case, we get a list of everybody that they've been around in that 48 hours. And generally people are good about letting their contacts know that they've tested positive. But we also do follow up with the contact because we have to let them know that they need to isolate. We send the index case, we send them isolation guidelines and do their symptom analysis interview and enter that information into MAVEN. And then also for the contacts, going back to the contacts, we have to email them quarantine guidelines. So we call them and answer their questions and find out if they're having any symptoms. We have to email them quarantine guidelines as well as go over them on the phone. And then again, answer any questions that they might have. So, you may have one positive case that may have, say, for example, either been at work or been around family members within that 48 hours. And we have to contact all those people and be in touch with them over the phone, via email, and we have to enter that information into MAVEN as well. So as you can tell, even just one case involves a lot of work. There's a lot of information gathering that goes on. There's a lot of entering into the database that goes on. There's follow-up. At the beginning, the guidelines were that we were supposed to be in touch with the index case every day. We were supposed to get temperature logs, record all their symptoms, and if any of them have improved every day. And now, because the number of cases has increased so dramatically, they've basically moved away from that. And they've told us index cases can be contacted once every 7 days now. And obviously, in the email that I send them out that has the isolation guidelines, I customize it to whoever I spoke to. And I write, if your symptoms worsen or if you develop shortness of breath, make sure you get in touch with your primary care doctor. If you need to be transported to the emergency room via ambulance, make sure you're telling the first responders that you've tested positive for COVID-19 so that the first responders can also make sure that they're protected. And so that's kind of the thing. And also let me know, if any of your symptoms change or if your symptoms improve, let me know so that I can make note of it. The discharge guidelines. So if you're quarantined, that quarantine period is 2 weeks from your last exposure to the positive case. So now we have to look at a calendar, figure out when they were with the positive case. And that date is day 0. The following day is day 1. 14 days out ends their quarantine period, as long as they don't develop symptoms. In terms of the index case, which is the person that's lab confirmed positive, the way that we do their discharge is that they have to be at least 7 days from the onset of symptoms. They have to be 72 hours free of any fever-reducing medication, and their respiratory symptoms have to be improving. So those 3 conditions need to be met before somebody can be discharged back into the community and end their isolation. Now you talk about families that have children, you talk about a mom or a dad that, has to take care of their kids. So what happens to these kids? Because say the parent has tested positive, so we have to make sure that the parent is isolating as much as they can. But we get it. They have kids, and kids have needs, and they need to be taken care of. So then the child begins their quarantine period. So they're being quarantined while their parent is in isolation. But then the child also has to quarantine for another 2 weeks, because that would, because it's dependent on the date of their last exposure. So if a parent is not able to isolate fully, which means own bedroom, own bathroom, like eating on their own, like fully isolate, if they're unable to do that, the family could potentially be in quarantine for a really long time. So it's basically a lot of that kind of question asking and getting that information and advising people, because it's confusing. It's very confusing. And where the guidelines are changing every day, we have to make sure we're on top of it and telling everybody. That was kind of my long. Yeah.
One question, Irby.
Yeah.
The people that have been diagnosed and have had the testing, were they tested at their physicians when they developed symptoms, or what was the mechanism where they were tested so that they were identified? I mean, I know we're not doing any testing right now, and I'm not sure if, I'm just assuming it's from they have an issue, they go to the doctors and they have a test done, and they have, the symptoms, they have a test done, and then they're identified. Is that how we're getting the identification of these patients afflicted with this COVID-19?
So we advise people to call their physician. You don't really want to go into the office, because this is a very
Correct.
rapidly transmissible virus. We advise them to call their doctor's office. The doctors, they can telehealth with their doctor's office and kind of go through the symptoms, and then the physician or the nurse practitioner, whoever their primary care provider is, would then decide, do they qualify for testing? Do they not qualify for testing? If they decide, yes, they qualify for testing, depending on what hospital they're affiliated with, they can just put an order in, and the person can go to a mobile testing site, like such as I think Saints Memorial, that campus has a mobile testing site set up. And if the respiratory symptoms are really bad, I think the physician mostly advises them to go to the emergency room where they would be tested. So that's kind of the process for how people are getting tested. And some people are not even getting tested. Some people, the physician, their primary care provider may say, well, you know what, we're not going to test you. You're showing all the symptoms. You probably were exposed at some point. So we're going to clinically diagnose you. Those numbers are not included in the numbers that I just shared with you, because there's no way of knowing who
Right.
those
There's no way of
cases
getting
are.
the data. What is the
Exactly.
what is the numbers that aren't reflected? Just out of curiosity for our community, because as you said, we had 48 that were active, 11 and have been cleared, and then the remaining 37, I believe, are still considered active. What kind of numbers are we talking about that are not indicated but are still important to be aware of?
I mean, we don't have that number, just because if a physician is not reporting it to us, there's no way for us to have that number.
Okay, so they're not even tracking the ones that. Okay, I was hoping that possibly some of the patients that physicians had seen that they did put them consider them with COVID-19. They may have kept a log of that without the testing, because maybe the tests weren't available, maybe the tests weren't, they weren't readily accessible, or whatever. That's why I was just wondering that I understand.
I mean, that is an interesting question, and I do wonder if physicians' offices are keeping track of it, and hopefully will maybe report that.
I would hope they would.
As of now, I just don't have the time to do outreach to the different physicians' offices in town to get those numbers.
Understandable, Irby. Understandable. Yeah. I'm just saying that, if you're treating for someone, because the reason why I say that, because of the way the communities are and word spreads very quickly amongst people, they may be assumed to be being treated for COVID-19 when they may have something else. And that's why my concern was that if you're treating someone for COVID-19 and you don't have a test that shows that for sure, I honestly
understand
think
what
being
you're
a provider, I
saying.
would correct.
I think generally the physician's office assesses, like, have you been around somebody that's tested positive for COVID-19? Like, if they have a household member that's tested positive, it's safe to assume that this contact has had exposure. If they develop illness within that 2-week incubation period, it's safe to assume that they probably did get the virus from their household.
No, and that's good, and that's good to know when we're talking about that with people. But I'm saying that I also look at it from the public's perception too, because everyone's going to assume, and so that's the criteria that they are using. Because sometimes I could see in the effort of expediency, if it looks like it's close, then they would go with it. But so we just don't know 100%, and that's okay. And I understand it, and I don't
Right, and
expect you to have to face
that again
that
is
haven't been identified.
Yeah, that again is just, I think, linked to testing kits. And I think it's really more important rather than, I mean, obviously we need numbers, but if you have somebody that's potentially COVID-19, like they need to start isolating. That's kind of so that you're mitigating the situation kind of right away because you're stopping the spread.
Oh, sure. Sure.
Yeah. So, and also actually in terms of testing for COVID-19, they'll usually rule people out for the flu and strep before they test them for COVID-19. That's kind of the protocol that's been in place in most hospitals. If a person tests negative for the flu and for strep, then they'll test them for the COVID-19.
Yeah, no, I'm aware of that, and that's why I was saying when people were putting them in, just because they may or may not have been around and they have similar symptoms, have they ruled out the other things before they do this with the COVID-19? So I mean, we've got a lot of variability on the types of patients that haven't been included in the numbers, which is fine. And
we've been
now we
told
just deal with the facts.
We've been told by DPH to focus on the confirmed cases and their close contacts.
Sure.
Because that's the only way that it would be manageable.
Yeah, no, absolutely understandable. No, thank you for that update.
But it's good to know. It's good to know that there are people that are clinically diagnosed that are out in the community, hopefully at home, but that so we should use caution all around by doing the social distancing, the physical distancing, the hand washing, covering the cough, all that stuff. All that stuff is definitely kind of the primary defense against spreading the virus.
Well, no, it's good, and it's good people are quarantining because, for example, there may be some people that have relatives that are out of state, and maybe some of the high risk areas that they come home. I mean, a lot of stuff's going on with the colleges and people with college kids and people working. They're coming home, and if they've just quarantining automatically, that definitely helps the situation because I know for facts there are people coming from some of the hot spots in their home, and they just immediately just stayed within their family situation and have just self-quarantined for the 2 weeks. As you said, sometimes it may be a long time before people can come out based on the different responsibilities and the needs of the entire family. So,
exactly.
But that's good.
Right.
It seems like what's being done, it has had a positive effect though so far. So that's all good.
And it's good to have that little bit of gray area, like you were saying earlier too, because it really lets us, provide appropriate care for each case, right? So it's not black and white. Like some people are going to have other circumstances. Some people maybe are just single and they're, one and done and they're done, where other people, they may be taking care of adult parents or children, or other family members, they may be the primary caregiver. So every situation is different. And I think that those gray areas allow us to, to specialize our communication with each family or with each person, which is a big part of nursing. So, so it's good. It can be kind of tricky at times because you do have to kind of look at does this mean this or does this mean this? But that's good because it allows us to use our nursing judgment and our clinical judgment, our critical thinking skills, and really, specialize the advice that we give to each person and really make it individual focused rather than just a blanket statement that obviously doesn't work for everyone.
No, and nowadays with WebMD and everything, people start to self-diagnose themselves all over. So it's just when you're dealing with the large groups of people in a pandemic going on, sometimes symptoms mimic other situations and other
Right.
issues.
Right.
So now people are like, and it's more allaying the fears of what's going on within any community and the people. So I'm like, just because it looks like a duck, walks like a duck, it probably is a duck, but it may not be. And I think that sometimes that adds to the confusion and the fear that some people have. So
Yeah.
it's good that you were dealing with the facts right now. So thank you again for all your work and everything. Greatly appreciate the update.
Thank you.
Does anyone have any other questions for Irby?
I just have one follow-up question on the recovery side, Ray. For Irby, I know that she had mentioned that there were several people in recovery. Just wondering exactly whether or not there's still a shedding issue, whether or not people should be fearful of someone that's recovered. Can she expound just a little bit on the recovery side of the virus?
Sure. So as you know, this is new for everybody. It's new for the epidemiologists. It's new for the health departments. It's new for everybody. We're still learning about, the exact process of how this virus is going to pan out. But generally, the spread is through droplets, right? So if your symptoms are resolving, if your cough is resolving, chances of you spreading are going to be decreased just by that decrease in cough and that expulsion factor. So, I mean, it's hard to say right now. We just probably should be a little bit more cautious, just err on the side of cautious, because we just don't know enough about it. And the data is still being collected, and we're learning a lot from the other countries, but it's an evolving situation, and we do the best that we can with the information that we have at the time. So I don't have an answer for that, unfortunately. But what I would say is, if the cough is resolving, your chances of spreading are definitely decreased if you're still shedding, if you're even still transmitting. But again, the MDPH has advised us it's 7 days from the onset of symptoms, 72 hours, no fever-reducing medication, which means, so even if you take Tylenol on the 7th day, even if you take Tylenol for a headache, that doesn't count. I mean, that counts, I should say. So that means you still have to wait that 72 hours because you could be masking the fever.
Yeah, no medication whatsoever. Yeah, absolutely.
Yeah. So yeah, I don't have an answer. We're all just learning about this, and hopefully we'll have a good idea soon. But as of right now, there's no definitive answer that I know of. I don't know if anybody else has any thoughts on that, if they've read anything anywhere.
That's important that you don't have the answer, and the caution needs to continue even with people in recovery. And that goes for people in their own family unit. Understand that just because it's abated doesn't mean it's gone. It doesn't mean it can't be transmissed. Those are good answers, even though there's no definitive answer. Thank you.
Right. And again, also like the reinforcing of the cough etiquette, the sneeze etiquette, the washing the hands, washing commonly touched surfaces. Really, I think if a person in your home has recovered, and because we don't have answers yet, that would kind of be, again, like our first line of defense: wash your hands, cover your cough, cover your sneeze, and sanitize.
Thank you.
Thank you, Irby. Thanks a lot.
Irby, one last question for you. One of the things that we on the board have been talking about between us are more on the education standpoint. And we've been discussing, well, it's really for those businesses deemed essential, especially supermarkets and the hardware stores. Early on, people were not practicing social distancing, and we talked about what could we do as recommendations. And thankfully, all of the Walmarts, the Home Depots, Market Baskets, have all come up with their own policies for social distancing, making sure they limit how many customers are in the store at one point in time. But there are two things that I still see as an issue. One is, it's a very easy remedy. Just have a Ziploc bag in your car so that when you are wearing gloves and or mask, you have a place to properly dispose of those items once you do get in your vehicle, and then to have the hand sanitizer with you so you can clean your hands once you've properly removed the glove and mask and properly dispose of it in the bag, because a lot of these parking lots do not have waste receptacles for people to put their gloves and masks in, and we don't want them just dropping them in the parking lot, but just have a Ziploc bag. And the other thing, and I've seen this a lot firsthand, is that while people are good about practicing social distancing in supermarkets, I am shocked at how many people are going in and shopping for groceries as if there was no pandemic. People pick up the item off the shelf, they'll read the label, they'll decide, well, that's not for them. They put it back, and they'll be going through and touching a whole bunch of things. And it's really safest if they pick an item up, it goes in your cart, that's what you're buying, because we're trying to prevent the spreading of this disease, and we don't know if that person's picking up that item is either carrying it or someone else before and picked up that item, and the COVID-19 is on that item, and now the person picks it up without gloved hands, now has it on them. So I just
No,
would have asked, do you have any other?
That's a valid point, Ray. That's valid. I've seen that myself, and I think people just have to have. I think they have to have a little more prudence and preparation when they're going into stores, and just do a little bit better planning, because I do agree with you in that part. I've seen and I've heard situations where they're trying to maintain the social distancing appropriately based on the size of the facilities that people are entering, and still, some people get upset if they forget something coming out of this grocery store, and then they want to be let back in immediately. I mean, I think that people have to and I think from a Board of Health perspective, I think we need to just reiterate and remind people a little kindness goes a long way, a little more patience. Nobody really truly understands all the consequences and all the issues that we're dealing with at this stage of the game. And I think it's really important that we can kind of just put little reminders out there for people too. I just think that people, they a little bit of knowledge, they understand, but the other things they revert back to their basic ways. And I think that people just have to, do a little bit more forethought and planning when they do go into stores or whatever, their stores or restaurants or whatever, because what we're doing so far seems to be working, but you're getting these lapses. But I also think, too, for people that common sense is sometimes, I feel, in short supply, but for people that are disposing of things in improper, just because the store doesn't have it now, and I think we can make the stores, the parking lots and the facilities be made aware, and I'm sure they're more than happy to provide trash receptacles for this stuff. But I think that for people that don't care about what's going on with the rest of the community, because the whole purpose of this is to care about ourselves, our families, and others, so we don't reinfect people that may not have even had it in the first place through our good follow through, but other people that are reinfecting people because of sloppy habits. I think there should be some ramifications for people that are seen disposing of stuff in the parking lots or on the streets or whatever. I'm not sure whether there's something we can coordinate with some of the other departments there, but I think that that's important to let people know that we're just not going to let it happen, because it does risk putting the whole community at an increased risk, or someone's going to be picking it up. And one thing I find is like just reinfection. Sometimes people just have to go home, get better before they go in, because sometimes they go back in early for work, they go back in early for something when they're not fully healed, and then the cycle just continues and goes on and on. So I do know I did see something that made sense to me when they had the Surgeon General on, and he suggested a protocol for how, and someone asked him directly how he manages his grocery shopping habits, and I think it's something we as a board can discuss, and it should be something simple that we can, put forward, in maybe a little maybe a little link, or maybe in just some pictures we can put together and mount. One thing I did want to ask Irvi, and it's nice to have calibration. I noticed that because I had seen on the news, especially considering what Market Basket had done to try and alleviate the situation, were some of these local stores or management of the stores in contact with you about recommendations, what they should do for the administration of people, letting people into their facilities or not? I'm sure you've been inundated with phone calls, because what I think would be nice for us as a community to do and have it on file is give some guidance. We don't want to tell people what they need to do, but recommendations so that we can still continue to function at a decreased level until we are able to identify people that have had these viruses and are on the mend. But has anybody contacted you about what they should do about social distancing for their entities, Irvi? I didn't. That's one question I wanted to ask, because I'm wondering where are they coming up with some of these things that they're deciding upon, because I feel as a community we should help them make some of these decisions so that
that's a very good segue. Not to cut you off there. Very good segue.
I'm going to defer to Susan.
Shannon has been working with the food establishments and other things, so maybe she can tell you about, we've been getting feedback, and then she sends them some things out. So Shannon, are you on?
So they've contacted Shannon already, so was Market Basket, for an example, not because they've been doing a good job there, and I commend them in spite of the challenges they deal with, just dealing with people in general sometimes. But did Market Basket reach out to you, Shannon, with some requests for guidance before they implemented it? And the only reason I'm saying that is since Tewksbury and Market Basket are very intimately associated, I was just wondering if they had reached out to you before they created a policy.
No, they hadn't reached out to me regarding that, like the number of people or whatnot, but they had started their own procedures without me even talking to them. I have been sending out emails to the establishments every couple of weeks. I send out an email or two.
Can you send us those emails that you're sending out to people? Because I know I wasn't made aware of them. It's nice to see, just because I think we as Board of Health members get queried by people sometimes, and
Right.
if you can just put us on that distribution list as you send emails out, I think it would be helpful.
Yeah, because we were getting some phone calls about people not wearing gloves, and gloves are good if you use them in the right way.
Sure.
And if you're using gloves and touching multiple surfaces in your face, it's the same as having dirty hands. But right now,
Yeah, no, absolutely. I mean, you can see people don't even wear them; they don't wear the mask
Right.
well. I mean, I see that, and I get it, and I see that a lot of people that, as I said, in today's world of quick information, a lot of people, they don't know what they don't know, and they don't understand all the reasons. So sometimes they may not understand, even though their intentions may be good. I guess there's an old saying about
Right.
intentions, but yeah, and that causes some issues, and also sometimes the squeaky wheels get the grease, and I'm not sure that the squeaky wheel is always correctly squeaky. I guess it depends on who is squeaking, but that's why I was wondering, Shannon, because I think that we as a Board of Health, we can help give the guidance for these entities so that they can remain in business, they can service the public safely, because so far what's been going on has been showing positive results, and I think we can continue that. But as I said, I don't want to throw the baby out with the bathwater.
Yeah,
because
so on Friday we got, or Thursday, I think it was Thursday, we got a complaint about Dunkin' Donuts, and I mean, several Dunkin' Donuts locations that I've been to that haven't been in Tewksbury have been using gloves. But again, I sent out an email asking people to use gloves, not ordering them to, but just asking, because those are the kind of phone calls we're getting. So
Sure.
I got a phone call from the manager in Tewksbury that goes around they manage multiple locations. So I don't know if any of you have been to a Dunkin' Donuts recently in town, but I actually went this morning to the one across from Mark Basket. And they implemented a tray. So instead of handing you your coffee or taking your card, you put it in the tray and you take it yourself.
No, I've seen it. I have done just some spot checking on my own to just see what's going on, just because I travel quite a bit. So yeah, I have seen some positive things going on. I have seen people using gloves and serving and dealing with it, or having one person dealing with the cash and dealing with cards and stuff, and trying to wipe things down. So it's all good. I mean, I think many people are trying to do the right thing, and I think it's great. As I said, I was not sure what was happening as far as like within our community, and I know that there's conflicting information that goes out amongst other communities too. Just like when people were calling and they're doing these things, especially the bigger entities like possibly Walmart, or like I said, I know Market Basket was doing a commendable job. I'm just wondering where they were, did they contact the boards of health administration to
So when we also suggested, well, actually had them close like self-service coffee at like 7-Eleven and Cumberland Farms, because again, that's a surface that's highly touched by multiple people, which could be a way for the virus to spread.
Oh sure, trying to just minimize, kind of like just eliminating portals where issues can arise. So no, that's great. As I said, I just wasn't sure. I saw that and I'm like, geez, they did it, and it made sense. I think we got to find the optimum amount of space where it can be efficient for people and also be safe and follow all the guidelines, and yet not be too restrictive is where my concern is becoming, because I've seen that.
Yeah, that's why we're doing recommendations.
Yeah,
if they do close, then they can go in there and clean and pull equipment out and do things like that, so it makes inspections go faster in the future.
Oh, sure. And also for local restaurants and establishments that are serving takeout, have you noticed in your travels? I'm noticing that, and I can only speak because I'm an essential provider and I am able to travel throughout. I've noticed different things that are doing. Even though there may be 6-foot spacing between some entities, some facilities, sometimes it may take a while for someone to maybe make a sandwich or do something where people are in these areas that it might be, rather than being quarantined 6 feet apart from people for 20 or 30 minutes, which is what I have observed in local restaurants around here, because I've seen that and I've heard that. I'm wondering if maybe it may be more beneficial for some of the facilities that have these spaces, rather than have a lot of people congregate inside, even though they're 6 feet away from each other, to maybe either go in and place an order and have it done, or maybe have the numbers for the restaurants more prominently posted outside so people can call, pick their stuff up. I've seen some restaurants that are doing travel and takeout where you call in, the orders are ready, and people come out, because I have just seen some, and this is personal observation, which troubles me, because I don't want to see anybody have to hang around any kind of facility for any length of time. And some of these people may be essential providers that are out there trying to do things, but I've seen, I think any facility that has someone hanging around more than maybe 10 minutes to wait for an order or whatever, I think there's some potential for some possible longer-term exposure to things that are going on. And I don't know if you've observed that too in your travels.
Well, Tony, as a customer, as I can tell you, as a customer who pretty much every day I've chosen to order out while I'm working, just because I want to get out there and see what people are doing. I've either been met at the door and handed the item, or I have gone in and out so quickly. One common thing that they all seem to be doing now is they're taking their chairs and blocking the closeness you can get to the counter. So it's very interesting. They're all blocking the closeness to the counter, and there's a lot of plexiglass up. There's a lot of a lot of that. So I've had a really good experience so far, and
Well, that's
really
great. I know that you and
patronized
I think that's wonderful, Susan. And I know you and I spoke without mentioning names and without going into concerns that I was made aware of by some people in the community that had contacted me.
Definitely pass that on to us when you get them. We'll follow them up, definitely.
Yeah, was well what we had mentioned about when you and I spoke last week. Was that addressed? Because
Yep.
to my knowledge,
Yes, it did, yes. And I
Okay, well-
thought he was reaching out to you. So that was the gist of the conversation. That particular person was going to reach out to you. So
yeah, maybe you and I can talk a little bit about this later. Yeah, I did get a call from that, but I think maybe afterwards you and I can talk. I just wanted to, like I said, it's great to hear that that's happened, and I think that maybe we just need to make sure that it's happening.
Yeah, anything you guys see, let us know. Shannon's ready to send out another one. We're probably going to talk about the gloves. We'll talk about baskets for people to dispose of. She had a really good idea. No one really likes the kind of trash cans that you have to push in. We really just need some kind of an open one. So we're going to send something that shows kind of an X on, don't do this kind of a trash can, because people don't want to touch anything. They're very, very specific. So they just drop them on the ground. So I think that's going to be part of the next one. Okay, thanks.
And I haven't seen it as it's been a little bit better, and I just think that it's just all on us looking out for each other, and I think it'll all be work out in the end. But sometimes you do get some people that are inconsiderate or whatever. They're in a rush, and we will have to commend all the people that do work in these facilities that are providing food and groceries and home supplies or whatever, just to kind of keep the world going while this virus is going on. But I think that that's imperative that we still have some consciousness while we're working together. But yeah, that's great. I know I had put together some stuff. I know I spoke with the chairman, and I'm sure you folks have it too. But talking about the proper donning of masks and proper donning of gloves, that maybe they can be. We can, not everyone has the links to the computers. Even you would think so nowadays, but not everyone does. But I'm thinking even a little bit of a pictorial that can be easily printed, or maybe we can work with some of the even some of the school kids that are home getting a little bit bored doing some stuff, drawing some. If we have a standardized form and maybe have a little I don't want to say make a little game for people to draw some nice pictures that they can put in, just, mount on the door, have a certain size limit, have a certain number of words, a pictorial. Have you done this before you go in with just gloves and masks and disposing of them? Because I know we had discussed this a little, probably the end of last week. So it's all good stuff, and along with the chairman was saying. But yeah, I will speak to you later about what my concern was. But I'm glad that you've been frequenting a lot of the places, because that's been my experience. Many places have. It's just whenever I see groups of people, even though they're practicing social distancing, 6 feet apart and anything in facilities, it's kind of like better just come in, order it, and go out, and it just minimizes the risk and it keeps people more healthy. So that sounds good.
Well, thank you, Tony. And seeing that we're coming up with just over an hour, Susan, is there anything you'd like to say in final words before we meet again next Tuesday?
There's a lot to say, but just everybody's doing a great job. I want to thank Irvi and Shannon and Richard and everybody, and just Chief Voto, Chief Hazel. There's a lot going on, and it's a lot of moving parts all the time. So there's probably 10 things we didn't talk about today, but I really appreciate having this time, and we'll do it again next week.
Sounds great.
Okay, and since this is an actual meeting, we'll need to have someone make a motion to adjourn today's meeting. It looks like Mr. Ruse dropped off the call, so someone like to make a motion to adjourn today's meeting.
I'll make the motion, like to adjourn today's meeting, Board of Health, the special meeting we had on COVID-19.
Okay, and I'll second the motion.
I'll second the motion.
Okay, so Maria seconded. So motion's been put forth and seconded to end today's meeting. All those in favor, we'll do a roll call vote. Mr. Scarano? Yea or nay to adjourn today's meeting?
Yay.
Okay. Mr. Rulis?
Yay.
Okay. Mr. Bichetti?
Yay.
Chair votes as well, so motion carries unanimously 4-0. So thank you, Tewksbury, for staying tuned, and we'll have our next meeting next Tuesday at 1 o'clock. Be safe, everyone.
Thank you.
Thank you.
You as well. Thank you.